You hear a urologist talking to a new patient called John Oswald. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hi, John. I'm Dr. Lane. I understand you've been referred to me because you have an enlarged prostate. What your doctor believes is likely to be benign prostate hyperplasia.
Yes, it's been troubling me now for several months.
Now, I have the referral here, but could you tell me in your own words about your condition, the treatment you've had, and anything else you think I should know about?
About 6 months ago, I found that when I tried to go to the toilet to pee, it seemed to take forever to start. Then, once I finally got going, well, it was like turning a tap on and off. It was just these short bursts over and over again. It was really uncomfortable at work. I even avoided using the office bathroom in case my colleagues noticed. At first, I honestly thought it was because I was drinking too much coffee. So I started having a lot more water instead. But that didn't do anything for the flow. And then, well, sometimes it continued to trickle out a little after I'd finished. I even began taking spare underwear with me, which I quite often needed. I'm only 51, and so I find it all rather humiliating.
Yes, it must be very hard for you. However, I assure you it is a rather common condition and it can be treated. Could you please tell me if you have any family history of prostate issues?
My father passed away about 5 years ago from prostate cancer, so you can understand my concern. I've asked his brother, my uncle, about his health, and he just refused to discuss it. I guess it's a sensitive issue. My auntie says that he has something called chronic bacterial prostatitis. He takes antibiotics for it, apparently. My own brother, he's a couple of years younger than me, had really bad bladder pain for about a week or so, about 3 years back, but that just resolved by itself. He didn't take anything for it. I'm only going off of memory here. I just don't want to leave anything out, but I seem to recall my grandfather having really bad genital pain. Both of my grandparents passed away many years ago, so I have no way of knowing for sure.
Thank you for all that background, John. Now, could you please tell me about the treatment you have had so far? Any medications you have been taking?
My doctor suggested I try alpha blockers and even recommended a surgical procedure called a TURP. But I was against it all at the time because I really thought it would go away by itself. When it didn't, well, you'll probably laugh, but instead of going back to my doctor, I tried some natural remedies. First, I tried pumpkin seeds. I read about it online, but they didn't do anything at all. At the same time, I was having saw palmetto because apparently they work well together. One remedy I tried was actually quite helpful. That was rye pollen extract. It seemed to lower the urgency to urinate. What else there? There was a type of berry, cranberries, but they come as a kind of dried powder. You mix it with water and it's a bit tasteless, so I just took it for a week. Only last night I tried taking some stinging nettle.
OK, thank you for that. And may I ask if after all this you have reconsidered having the TURP?
I'll be honest with you, I've been petrified of hospital since I was a kid. Obviously, I've been in and out quite a few times since then, but it's never ended well. Let's see, I broke my leg when I was 14, and they put a catheter in, which led to getting an infection. I still remember the pain. When I was 22, I was in a fight and had my nose and eye socket broken. I had a bad reaction to the anaesthetic after the operation and just couldn't stop vomiting. I was so nauseous. I know it seems ridiculous at my age, but those memories are strong. And of course, my father's passing didn't help. It's the environment, the chaos, the beeping machines. My worst memory, and what makes me feel physically sick to this day, is the smell of the lemon disinfectant they use to clean the floors. It's just awful.
Many people have such feelings. How about I take you through what I believe are the best options for some...